Hello and welcome to the Independent Custody Visiting Association's Bitesize training on mental health. I'm Stacey Evans and I'm the Interim Chief Operating Officer. If you're viewing this video via YouTube and you'd like to view captions, please click on the small CC button on the bottom right hand side of your screen. There's a short exercise and a quiz during this video, so you may want to get a pen and paper ready. And finally, there's a further reading document to accompany this video, which your scheme manager will be able to share with you. We hope you enjoy the training. So let's take a look at our objectives for the session. Firstly, there'll be an introduction to mental health. I'm going to talk to you about Section 136 of the Mental Health Act and liaison and diversion services, and equip you to report on key mental health issues in police custody. So we're going to start with an exercise. I want you to think about what is your experience of mental health and custody. And what challenges do you face or have you faced when reporting on mental health in custody? So you can have a couple of minutes, you just need to press pause, and when you've had a chance to think about them, you can press play again. I hope you've had a chance to think about those questions. As number one is your experience of mental health and custody, we'll move on to number two and have a look at some of the challenges you may face when reporting on mental health and custody. So, firstly, custody may not be able to ascertain if the detainee does have mental health concerns, or the detainee may have another condition that's masking their mental health concern. They could be vulnerable, they could be intoxicated, for example. And it's really important that ICVs remember that you're in custody as members of the public and should not be seeking to diagnose mental health issues. Someone in crisis may not want to speak to an ICV, so will be unable to determine their experience in custody. And if you're not sure whether someone is experiencing a mental health crisis, just report it to custody staff and log it in your report. And a bit later on, I'm going to talk to you about the types of things that could complicate identifying mental health problems in custody. So now we've had a chance to briefly think about some of the challenges we may face when reporting on mental health and custody. We're going to move on to have a look at what mental health is. Now, in many ways, mental health is just like physical health. Everybody has it and we need to take care of it. So Mind, the mental health charity, state that good mental health means generally being able to think, feel and react in the ways that you need and want to live your life. But if you go through a period of poor mental health, you might find the ways you're frequently thinking, feeling or reacting become difficult or even impossible to cope with. And this can feel just as bad as a physical illness, if not worse. Now, mental health problems affect around 1 in 4 people in any given year. They range from common problems such as depression and anxiety to rarer problems such as schizophrenia and bipolar disorder. It's important to note that mental health is separate to neurodiversity. If someone is neurodivergent, this doesn't mean they have a mental health condition. However, the National Autistic Society explains that mental illness can be more common for people on the autism spectrum than in the general population. So it's possible that some detainees may have aspects of more than one of these areas. And there is further reading on the Mind website. You see this little icon down the bottom. I'll pop a link to that on the further reading document. I briefly talked earlier about the challenges you may face when reporting on mental health and custody. Identifying mental health problems in people in police custody is complicated by the high number of people being detained who are intoxicated on arrival at the police station. The number of people with other conditions which mask the mental health condition. The lack of a standard mental health assessment. A reliance on self-reporting. And barriers to disclosure, including stigma or a previous negative experience in the custody suite environment, for example. So now we're going to take a look at some of the acts someone in police custody may be detained under. So the police have powers set out in the Police and Criminal Evidence Act of 1984, or PACE as you may know it, to detain those they have arrested on suspicion of committing a crime. The police have separate powers to detain those suspected of terrorism offences under the Terrorism Act of 2000. And the police also have powers to detain adults for their own or others' safety under Section 136 of the Mental Health Act of 1983. Now, adults detained under Section 136 of the 1983 Act can only be held in a police station in exceptional circumstances. Anyone under 18 years old should not be detained in a police station as a place of safety in any circumstances. People with mental health needs may be detained in police custody under PACE because they are suspect in a criminal investigation, or for their own safety or that of others, as we've just said, under mental health legislation. So the emphasis there is on adults. Anyone under 18 years old should not be detained in a police station as a place of safety in any circumstances. So people with mental health needs may be detained in police custody under PACE because they're a suspect in a criminal investigation, or for their own safety or that of others under mental health legislation. So let's take a closer look at what Section 136 says. Under Section 136 of Mental Health Act 1983, if a person appears to be suffering from a mental disorder and in immediate need of care or control, a constable may, if they think it's necessary to do so in the interests of that person or for the protection of others, remove the person to a place of safety or keep the person at a safe place. Now, Section 136(1)(a) allows this power to be exercised in any public or private place other than a house, a flat or room where that person or another person lives, any yard, garden, garage or outhouse that is used in connection with the house, flat or room, other than one used in connection with one or more houses, flats or rooms. Now, if you want to read more on the Section 136 of the Mental Health Act, I can pop a link onto the further reading document. So now we've looked at what Section 136 is, we're going to look at what exceptional circumstances means. Now, the Mental Health Crisis Care Concordat, launched in February 2014, committed national organisations to working together locally in order to stop the use of police stations as places of safety, apart from in exceptional circumstances. Now, exceptional circumstances in which a police station can be considered a place of safety is when the behaviour of the person being detained poses an immediate risk of serious injury or death, such as no other place than a police station can reasonably be expected to detain that person, and an officer of at least the rank of inspector has authorised the use of a police station as a place of safety. And the reason for this is because police cells are not suitable places to detain people thought to have mental health problems. A person's condition may be exacerbated by being held in that environment. And note there where it says poses an immediate risk of serious injury or death. That's a really high test for a police station to be considered a place of safety. So let's take a look at how often Section 136 is used in police custody. So data collected from police forces across England and Wales shows that there has been a reduction in the use of police custody as a place of safety for people detained under Section 136. 1,029 people were held at a police station under mental health legislation in 2016/17, and this has fallen to 159 people in 2019-20. So that's gone from 4% to 0.5% in the year to March 2020. Now, the MPCC lead for mental health and policing, Commander Christine Jones, said people experiencing a mental health crisis are not criminals, nor are police officers and staff medical professionals. Those who are urgently unwell, whether physically or mentally, should be taken to a health-based setting to receive the right care and support. It's unacceptable for anyone of any age to end up in a police cell because the appropriate mental health services are not available. So now we're going to take a look at mental health as a feature in deaths in custody. Now, deaths in custody are thankfully fairly rare. However, where they do sadly occur, the mental health of detainees often is a feature. Now, the IOPC have published a report on deaths during or following police contact. So these statistics I'm about to read are for England and Wales in 2020/21. So 19 people died in or following police custody, 17 men and 2 women. Their ages ranged from 24 to 85 years. 17 were white and 2 were black. 12 people were identified as having mental health concerns. Now, the types of mental health concerns included depression, schizophrenia, psychosis, anxiety, and self-harm or suicidal tendencies. And 2 people were detained under the Mental Health Act of 1983. Again, I'll pop a link to the IOPC reports on the further reading document if you do want to read more on that one. What is liaison and diversion, and when should it be used? So the health needs of all people detained in police custody should be assessed when they arrive. If a person is identified as having health needs, either physical or mental, the police should ensure that they receive appropriate medical attention. And there are local variations for how those needs are assessed, so you can prepare for your visits by establishing how that works in your area. So following that assessment, if they suspect an individual in custody has a mental health problem, including a learning disability, substance misuse or other vulnerabilities, the police should alert their local NHS L&D service. Now, the L&D service seek to either support those with mental health needs through the criminal justice system or divert them into treatment, social care service or other relevant intervention or support service if required. And they aim to improve overall health outcomes for people and to support people in the reduction of reoffending. And it also aims to identify vulnerabilities in people earlier on, which reduces the likelihood that people will reach a crisis point and helps to ensure that the right support can be put in place from the start. Again, there's further reading on this one on the College of Policing website, so I'll pop a link on there. So let's take a look at liaison and diversion in a bit more detail. So the main things that L&D services do for the people they see are identification, screening, assessment and referral to other services. So firstly then, identification. Criminal justice agencies working at the police and court stages of the pathway are trained to recognise possible signs of vulnerability in people when they first meet them. They then alert their local L&D service about the person, and in this case that's custody staff. Screening. Once someone is identified as having a potential vulnerability, the L&D practitioner can go through screening questions to identify the need, level of risk and urgency presented. It also helps determine whether further assessment is required. So then, if further assessment is required, using a trauma-informed approach and approved screening and assessment tools, an L&D practitioner will undertake a more detailed assessment of that person's vulnerability. And this provides more information on a person's needs and also whether they should be referred on for treatment or further support. And then referral. The L&D practitioner may refer someone to appropriate mainstream health and social care services or other relevant interventions and support services that can help. A person is also supported to attend their first appointment with any new services, and the outcomes of referrals are recorded. L&D services will also provide a route to treatment for people whose offending behaviour is linked to their illness or vulnerability. And then outreach. Multidisciplinary teams, including support time recovery workers and peer support workers, will work holistically, so together with people in the community settings during the currency of any criminal proceedings, including addressing issues such as housing and financial advice. Many L&D services are based in custody suites, but again there are local variations, so you may want to prepare for your visits by finding out about the L&D service in your area. I'm now going to briefly talk to you about appropriate adults for people with mental health conditions. And the reason it's brief is because there is an appropriate adult briefing and checklist and vulnerability bite-size for you to watch already. So the police are required to contact an appropriate adult whenever they detain in custody or interview voluntary under caution a vulnerable adult or a child or young person under the age of 18. Now, PACE Code C says that vulnerable applies to any person who, because of a mental health condition or mental disorder, may have difficulty understanding or communicating effectively, does not appear to understand the significance of what they are told, of questions they are asked or of their replies, and appear to be particularly prone to becoming confused or unclear. So you can see in brackets it says see notes 1G and 1GB, and that's because there are many other reasons vulnerable would apply to a person which you can read about in the appropriate adult briefing. Okay, so next we're going to take a look at how might custody be adapted for people experiencing a mental health crisis or with a mental health condition. And this list isn't exhaustive. You may be aware of other ways to support someone in crisis or more generally. So first of all, communication. Ask the detainee what they need. Distraction items. So this again is dependent on the custody suite. And these could include fidget items, so cubes, spinners and tangles, foam footballs and stress balls, distraction packs, colouring books, puzzles, cards, crosswords, word searches, edible chalk to use on the walls, easy read or picture books, for example. And an open cell door. Now this is dependent on the demeanour of the person. If they aren't violent or spitting, for example, then custody may decide to leave the door open if there's an appropriate adult or a staff member present. Exercise yard. So the detainees are entitled to brief daily outdoor exercise where practicable. An exercise should be provided individually and be adequately supervised. And again, that may be adapted then for somebody who's in mental health crisis. Perhaps they need more outdoor time. And then frequent observations. So the custody officer is responsible for managing the supervision and level of observation of each detainee. They take into consideration a detailed and up-to-date assessment of the risk that the detainee poses to themselves and others, and any recommendations a healthcare practitioner has made following a medical assessment. Now there's 4 levels of observations. That's a level 1 general observation, level 2 intermittent observation, level 3 constant observation, and level 4 close proximity. But if someone is detained under the Mental Health Act of 1983, a custody officer at the police station must ensure that the welfare of the detained adult is checked by a healthcare professional at least once every 30 minutes. So now we're going to move on to our first quiz. I'm going to leave the questions up on the screen so you don't need to write these ones down. Question number 1. When can adults be detained in a police station under Section 136? Question 2. Name the service that the police should alert if they suspect an individual in custody has a mental health problem. And name 2 things that a detainee experiencing mental health crisis should receive in custody. So you can just press pause now if you want to answer those questions. Come back when you're ready. Welcome back. Let's have a look at the answers. Number 1. When can adults be detained in a police station under Section 136? And that's under exceptional circumstances only. Number 2. Name the service that the police should alert if they suspect an individual in custody has a mental health problem. That's the NHS Liaison and Diversion Service. So if you've had both of those right, that's 2 out of 2 so far. And then finally, name 2 things that a detainee experiencing mental health crisis should receive. So they should receive an appropriate adult, screening or an assessment, frequent observations, and then depending on your custody suite in your area, there could be distraction items, for example, foam balls, fidget spinners, whatever your suite has available. So if you got that one right again, that's 3 out of 3, well done. So far today we've looked at what mental health is, its prevalence in police custody, we've looked at what Section 136 is, we've looked at mental health as a feature in deaths in custody, we've talked briefly about appropriate adults and the Liaison and Diversion Service. Now we're going to take a look at how ICBs can monitor mental health in custody. Now firstly, to prepare, you might want to find out what L&D service there is in your suite. So it depends on your area. There could be a Liaison and Diversion Service in the custody suite. You might want to find out if there are distraction items available, and if so, what are they? What is the suite able to do to support vulnerable detainees? Upon arrival, ask if there are any detainees with suspected mental health vulnerability in custody. If so, have they been assessed? Have L&D seen them, and do they have an appropriate adult? Those with poor mental health are vulnerable and deserve our attention. You may wish to prioritise those visits. During the visit, focus on rights, entitlements, well-being and conditions. If a detainee lets you know they're feeling unwell, ensure that staff are made aware. Let the detainee know that you will pass this on and make a note on your report. Check whether they have infrequent observations. And if the detainee is being held under Section 136 and is waiting transfer to a health-based place of safety, with consent, check their custody record and make a note of the length of time they have been waiting, and again, make a note of this on your report. And to reassure you, you should not be experts in mental health. You're in custody as members of the public and should not be seeking to diagnose mental health issues. Just be aware of behaviours that seem unusual or concerning and ensure that they are raised and actioned appropriately. You're encouraged to report on whatever feels wrong to you as a member of the public, and work should be praised where appropriate to do so. So now we're going to have a recap of our objectives for this session. So we introduced mental health. We looked at Section 136 of the Mental Health Act and liaison and diversion services. And hopefully we've equipped you to report on key mental health issues in police custody. I hope you've enjoyed this Straight to ICB resource. If you don't already have it, please ask your scheme manager for a copy of our further reading document that I've referred to throughout this video. I've also included links to other Straight to ICB bite-sized resources for you to watch at your convenience. And remember, you'll find the bite-size on vulnerability that is useful to complement what you've learned today. Thanks for watching, take care, and we'll see you all soon.